In terms of being an organization, let's understand this. You don't have a facility, a building somewhere that people simply call, make an appointment, and go see you. This is all, how do you disseminate this information? Do you get in touch with mandirs and temples and so on? Do you talk to people that way in community centers? How do you plan on getting your information out there?
We have been to some of the gurdwaras, and we've talked to them over there. We're finding that people do want to participate, and really the idea is once we get moving, like we don't have our own building or anything. The address is my office at the moment.
I see.
We're finding that people will need help, so I think where we have to reach out to now is the gurdwaras, the mandirs, the mosques, the churches, and get them to partner with us so they can get this information and disseminate and tell people that some of the old ways of eating, or where in gurdwaras the tea is homogenized milk only, that we get away from it and start eating wisely.
Going back to something that you were saying earlier, Dr. Suri, in discussing community health, it certainly shows where the organization attempts to position itself, where you're not, as I said earlier, not just talking about heart disease and diabetes and so on. Social health, that all concerns you, and working with youth. I mean, it's very important that I think our young people become aware of some of the things that you're talking about. Do you have any specific plan in reaching them?
I think you raise a good point. It's a holistic approach, because health is not just the absence of illness. It's mental, psychological, emotional, and spiritual health that we are talking about. So, apart from physical health. So, we have to put that all together to address these issues. Your concern was, or your issue now is, that how are we going to disseminate this information?
How do people get, so you've got a website, it's got all this information. How do I know that I can get the kind of help that I probably need, that you can provide?
Now, what we are hoping to do is we have a link for questions, where people can set questions up and ask us, and we can answer them. We have somebody who picks up the phone or takes a message, and we'll call them back.
I see.
That's one way. The second thing, we can link them up with other experts in the field if necessary. We're not in the business of being a referral center or giving information on a one-on-one, but we are community-based, community interactive, and educating whole communities all at once. And now with this mailer coming up, we have linked up with several charitable organizations, and this information now is going to be brought all under one roof. And people are going to see the whole vastness of what is available there. The resources are phenomenal. We just haven't tapped into it. So what we've also done is held educational seminars, both for physicians and non-physicians. We've had workshops, and we plan to do more. On our website, we have recipes that are heart healthy, etc. And we plan to continue improving on those kinds of health issues.
Well, you've touched on a very important point there. You're now launching this organization, and one of the ways of marketing it is with your health mailer that's upcoming soon. Ripple Effect Wellness Organization is having a mailer at the Pearson Convention Center in April 24th, I believe. Let's talk a little bit now about that mailer. What is it all about? What will we have there? What time it is, that sort of thing.
Well, this is going to be at the Pearson Convention Center, which is located at Airport Road and Steeles, just at the very corner of that. And it's close to the 407. And we have close to 24,000 square feet that we've taken up there, and very kindly hosted
that's
by...
quite sizable. That's a lot of space.
That's a lot of space. And what we'll have there, we'll have the opening ceremony like a traditional opening ceremony with the lighting of the lamp, etc. And then we will proceed with the actual Mela. We have demonstrations of various kinds, several booths with food, healthy food, various health products available. We'll have an area for children as well, and there'll be something like 45 booths, I believe.
We're having people who will demonstrate different techniques of keeping healthy. So it's going to be a place where, you know, you can see on an overall basis what may suit you, what may not suit you. The idea is to give as much information over there again as possible, launch our organization, and then keep following it up as time goes. It should be a fun-filled day from 10 to 4. It's not that you have to stay there for the whole day. There will be entertainment as well. There are Bhangra dancers. There are the people, the children who are, taught a certain way. So it's going to be something relaxed, fun-filled. Come in, enjoy, stay for an hour, stay for 2 hours, but get the facts as well. We just want to make people aware of what's happening.
Are you covering several different illnesses? You talk about community health and a holistic approach.
Yes.
How are you tackling that at the fair?
Well, we have our chief guest is Dr. Gopal Bhatnagar, who is the chief of cardiovascular surgery at the Trillium Hospital. And he'll be addressing the audience about end-stage heart disease and heart attacks, etc. We also have people who are going to talk about cholesterol reduction, prevention of heart disease. We have the South Asian Diabetic Foundation. We have a speaker from there. We'll have also demonstrations of how you can use different forms of art forms as exercise, such as yoga, meditation, Bhangra, Bollywood dancing, all kinds of things. So we're gearing the whole thing towards, as I said earlier, a total health package, not simply one particular area. But there will be booths addressing specific concerns, such as mental health, heart disease, diabetes, etc., where specific information is available to them. But so it's going to be some serious messaging and some fun times together. So it's a good combination.